Assalamu alaikum. Welcome to the world of Mentora. My name is Zubair Soleimani and I am the CEO of Mentora. Mentora is the first of its kind hybrid edtech platform in Pakistan. Dear colleagues, healthcare systems are expanding across the world faster than the supply of pharmacists. From hospitals to community, the demand of pharmacists is outpacing the availability, creating tremendous opportunities for skilled professionals who are ready to step forward. Today, healthcare systems are facing a widened demand supply gap. Populations are aging, which ensues increased healthcare need, and with age comes a higher burden of chronic diseases like COPD, asthma, cardiovascular diseases, etc. At the same time, there is a growing emphasis on preventive healthcare, keeping people well before they become patients. Pharmacists are no longer just dispensers of medicines. They are frontline healthcare providers, delivering vaccinations, managing chronic diseases, ensuring safe medication use, and leading public health initiatives. Their role is expanding into digital health, telepharmacy, and advanced healthcare. This shift has created an ever increasing demand for pharmacists as they are also considered as educators, guiding patients towards healthier choices. The message is clear: pharmacists are not just filling prescriptions, they are filling critical gaps in healthcare delivery. As the demand for accessible, safe, and preventive care rises, the role of pharmacists will continue to expand, making them indispensable in meeting the world's healthcare needs. Let's explore the demand of pharmacists in the global market. By 2026, Australia faces a shortfall of nearly 2,000 community pharmacists, with hospitals reporting over 20% vacancy rates, clinical roles in aged care and digital health to grow by 15%. Community pharmacies, especially in rural and regional areas, struggle to recruit, leaving gaps in primary care access. Canada anticipates a national pharmacist shortfall of up to 7,000 by 2035, with hospital departments already report 11% vacancy rates. While the demand for clinical pharmacists is expected to rise by 20% in the next decade, the community pharmacies face mounting workload pressures and uneven distribution, with shortages most acute in smaller provinces and rural communities. In Saudi Arabia, there are more than 30% of primary care centers which operate without pharmacist supervision. Hospital pharmacy workforce analysis shows an employment of 70% expatriates, which depict conducive environment. Clinical pharmacist demand is also forecasted to triple by 2030, and they are requiring 12,000 pharmacy professionals. Right now, community pharmacy services remain underrepresented in primary care. Dubai Healthcare Authority projects hospital pharmacists' demand to rise 40% by 2030, with community pharmacy workforce growing by 25 to 30%. Clinical pharmacist roles are expected to double by 2030 as multidisciplinary care expands, and Dubai is the country of expatriates. Across the wider UAE, according to a report, pharmacists to population ratio is just 6.5 per 10,000 persons, which is far below the average of Dubai and Saudi Arabia, signaling a strong demand growth. While the community pharmacist demand is rising by 5 to 7% annually, and clinical roles with telehealth projected to grow 15 to 20% by 2030 in rest of UAE. The global demand is clear, means health systems need pharmacists who are clinically skilled, digitally fluent, and ready to lead. Mentora is designed to prepare you for these opportunities, bridging the gap between education and practice, and equipping you to thrive in Australia, Canada, Saudi Arabia, Dubai. Dreaming of becoming a licensed pharmacist abroad? Your pharmacy degree is just a beginning. Mentora takes you further. But What is the challenge? Different countries have unique licensing exams like OPRA in Australia, PEBC in Canada, SPL in Saudi Arabia, DHA in Dubai. Many pharmacists struggle with lack of structured guidance and global exam preparation resources. Here, quality of your study matters, not the quantity. Experience has shown that pharmacists who attempted to study almost everything available, whether from textbooks, notes, or endless online resources, often ended up overwhelmed, scoring poorly, and in many cases, failing altogether. In contrast, those who adopted a smarter approach, focusing on a carefully selected and relevant curriculum, achieved far better outcomes. Success in licensing exams is not about the sheer volume of material consumed, but about strategic preparation. Prioritizing high-yield topics, mastering exam-oriented content, and applying knowledge in a clinical context. A smart study beats exhaustive study every time. Mentora is the first of its kind hybrid edtech platform in Pakistan that combines online learning and physical classes with personalized mentorship, tailored for pharmacists with or without prior clinical, hospital, or community experience. Let's explore how Mentora would prepare you for exams. Upon enrollment in Mentora program with country of your choice for individual country-specific learning, you will be entitled a personalized dashboard. Mentora offers all courses in two phases. Phase 1 includes preparation on topics related to biomedical sciences, which includes physiology, pathophysiology, and screening methods of diseases. It also includes biochemistry, immunology, and medical microbiology. Pharmaceutical sciences include medicinal chemistry, pharmacology and toxicology, pharmacognosy, pharmaceutics, biopharmaceutics, sterile and non-sterile compounding. Social, behavioral, and administrative sciences include country-specific healthcare delivery systems awareness, pharmacoepidemiology, pharmacoeconomics, pharmacy practice management, pharmacy law and ethics, professional communication, drug distribution system, collaborative care including intra and interprofessional care. Phase 2 includes clinical sciences comprising clinical pharmacokinetics and clinical pharmacy with focus on clinical reasoning, human body system based pharmacotherapy, special population drug monitoring, toxicology and drug safety, advanced care based practicum, and objective structured clinical examinations called OSCE, clinical pharmacology, evidence based medication, and therapeutic decision making. Extensive exam focused practice sessions with exhaustive case scenarios to prepare you for clinical pharmacy practice related questions which are now a talk of town. Online pre-recorded lectures would facilitate comfortable flexi learning with multiple time recaps and better understanding. On completion of a chapter, you will be asked to opt for MCQs related to your recent study. These tests can be repeated multiple times to feed your learning hunger. Periodic online live lectures and physical classes would be given depending on the complexity of the subjects and related queries of students. Remained unresolved in recorded lectures. Dates of these classes would be announced on students' dashboards. Upon successful completion of all chapters in a course, and once you believe that substantial understanding is developed on the subjects, you can opt for final MCQ test, which would become part of your report card. At particular stages, individual and group assignments would be given for scored results. A certificate would be issued upon completion of a course, and you would be advised to proceed for next course. Once all courses with certificates are completed in phase 1, you will have to pass the grand test. In case a student does not passes the grand test, he or she would be allowed to repeat all modules for unlimited times until they pass the required grand test without an extra charge. Upon successful passing grand test, you will enter phase 2 of clinical pharmacy learning modules. The advanced modules in this phase with extensive hour learning would finally prepare you for licensing exams. Once this phase is completed, you will have to appear in the final mock exam. Upon successfully passing the final mock test, you will be certified and will be advised to take licensing exam. Mentora also allows external students to appear in the mock test, even they had not completed their studies with us. Let us see how Mentora is different. Mentora offers hybrid pedagogy with online and physical classes, focusing on personalized yet collaborative learning through personal dashboards. Comprehensive yet smart curriculum with motto to offer quality rather than mere quantity. Current up-to-date therapeutic guidelines-driven method of teaching, more than 6 months of intense inclusive training, country-specific training for targeted swift learning including OPRA for Australia, PEBC for Canada, SPLE for Saudi Arabia and DHA for Dubai. Flexi hours of learning with pre-recorded lectures and online live sessions facilitating you to learn from the comfort of your home and leisure. A much needed facility for working individuals as we understand. Team of highly skilled teachers and professionals with decade-long experience of one-to-one training sessions. Diverse specialist teachers in their field of expertise as compared to one teacher conducting all courses. Robust compendium of books, lectures, videos, MCQs and notes which is accessible all the time. Integration of pre-recorded lectures, live online sessions, physical classes, compendium of resources in the training while dynamically examining through extensive assignments and MCQ-based exams. Dynamic and interactive pedagogy rather than the usual practice of just providing and charging enormous fees for nothing more than static, repetitive, unfiltered notes and study material. Self-paced, individualized learning with method of teaching suited to local environment. And last but not the least, allowance of multiple times repetition of courses without an extra charge. Join Mentora today and take the first step towards your international pharmacy career. Take a simple quiz and check your level of preparedness. Watch our demo class later on and witness how it simplifies approaching related questions with ease, which would appear in licensing exams. The world needs more pharmacists, and Mentora helps you become one of them. You can contact us at 0334 734 1607 or our website www.mentora.com.pk, or you can visit our Facebook channel www.facebook.com/mentoralms/. You can also contact us on our Mentora helpline on WhatsApp. You can scan the QR code to reach us, or you can mail us at our info and help desk email IDs, which are info@mentora.com.pk and helpdesk@mentora.com.pk. Let us make you pharmacists who are ready to serve, ready to lead, and ready to make a difference. Thank you.